Closer to winter and colder weather setting in, it's the time of year that the flu can spread, especially right before holiday gatherings. Today, Brady Bowman visited with local health professionals for a snapshot on flu cases here in Sedgwick County. Brady.
Rachel, the good news is that flu cases in Wichita are tracking to be about average for this time of year. But health professionals tell me safe practices like taking precautions and getting your flu shot are key in keeping it that way. AFC Urgent Care on North Rock has kept busy with visitors, but still a far cry from the hectic times of COVID, when it saw a high number of precautionary visits when much was still unknown during the onset of the pandemic.
In COVID times, we used to have that a lot. Like people would come and say, no, I want to make sure that I don't have COVID because I'm going to go and visit my family and I'm going to go and visit my mom and dad and they are, in a facility. We haven't seen that this year, I would say.
Dr. Mansour is the medical director of AFC Urgent Care. She says when it comes to the flu, you know it when you have it.
The symptoms are very classic. They will have high fever, chills, body aches and pains. Like they would know that they are sick. Mild symptoms of flu are very unlikely until somebody has a very good, strong immune system. Flu really beats you up a little bit. It would not be like COVID that you have no symptoms and you have COVID and then you can still give it to so many people.
Beverly Bruce, the Associate Director of Preventative Health at the Sedgwick County Health Department's West Central location, says numbers so far are where she expected.
So far, we are seeing pretty much average for this time of year. We are seeing about 13% of emergency room visits for respiratory illnesses, not necessarily just flu, but flu, COVID, RSV, things like that. Bruce
says there is one number up compared to last year.
We actually have administered more flu vaccines this year than this time last year. So I think that's good that people are getting immunized for the flu.
The CDC's flu tracker shows Kansas is at a low to minimal level for the number of cases, but that's not the case on our western border, where Colorado is in the red, reporting a high activity level for the flu.
Even New York has a lot of cases because that state is also red. And then here is Colorado, and then we are in the middle. People can even fly and bring the symptoms, right? So it's not even just traveling, but they can fly here too and can bring flu. So it's just anybody who is sick, they need to be more cautious.
Dr. Mansour encourages anyone concerned they have flu symptoms to find an urgent care rather than going to a hospital.
It's convenient and you can get the test done quickly. It's not very expensive instead of going to the hospital and exposing the whole hospital for those things because there are much more sick patients in the hospitals.
The health department also wants the public to be aware of whooping cough as it has become more prevalent nationally and often affects children more severely than adults. Rachel?